I pass you on to Stuart Nunnally, who will introduce our speaker this afternoon.
I practice down in Marble Falls, Texas, and it's great to be with you all, and especially a privilege to introduce Ollie to you today. Ollie Farahani is going to present today on the Eco Dental Office. Ollie has a Bachelor of Science in Environmental and Conservation Biology. He is practicing in Stratford, Ontario, and he's an accredited member of this academy. And Ollie has a new dental office as of April, and will be able to share with us all those important tips in having an Eco Dental Office, whether we're building a new one or whether we're retrofitting. So please join me in welcoming Ollie Farahani.
Thank you, friends. I'm just going to sort of stand here and operate the machine, and I have a few statistics, not many, and I'll need my notes for that. So, dear friends, it's a privilege to be here and share with you some thoughts on how to create a brand new practice. If some of you are thinking of moving to a location, your lease is expiring, et cetera, you want to move to a new location, you want to create a brand new environmentally responsible dental practice, or if you want to just eco-fit, rather than, we're used to the word retrofit, I like to use eco-fit your existing office into an eco-responsible one. Before I dive into the heart of my presentation, I'd just like to stop for a second and ask this question. Many of you belong to various institutions or academies other than the IAOMT. Many prestigious academies, perhaps. How many of those academies have an environmental committee? None. And of those committees, many of them probably do pay some homage to the environment. Beyond lip service, though, those academies, how many of them would actually give a spot in their symposiums to the environment? So these are deeds, and this is why this is another reason why the IAOMT is really far ahead of so many of its actual peers. Okay, first let's start off by defining what is eco-friendly dentistry. I define eco-friendly dentistry in three key ways. One, by protecting the external environment by eliminating or reducing the outgoing wastes. For example, reducing our burdens on landfills. Secondly, by consuming resources at a rate less than the rate at which these resources can be replenished, such as paper, water, and electricity. And thirdly, the one that's often forgotten, promoting a clean clinical environment by reducing the harsh chemicals in the air that we breathe every day in our clinics. After all, we are also part of that environment. World-renowned Harvard biologist Dr. E.O. Wilson coined a term, the death of birth, which in just 4 words crystallizes all the importance one can attribute to any action we take for the environment. The death of birth. So eco-friendly dentistry is not merely a feel-good endeavor, although it does feel good. There is overwhelming evidence of global climate change, and there's not a single peer-reviewed article in the last 25 years that's disputed that. And so I think it's incumbent on a profession like dentistry that prides itself on evidence-based practices, and the academy, which prides itself on science, to act and reflect on the most recent evidence of global degradation. And eco-friendly dentistry, I think, would be a great response to that. Okay, so this is our practice. We opened it up in April of 2007. This is our reception area. I knew our practice was going to be a new practice with no pre-existing structure or form. So as researchers well know, this really provides an ideal environment for research, because we have a blank sheet and we can adjust the parameters as we want. So I contacted the University of Waterloo, which is Canada's MIT, and I asked them would they like to do research on this with me, because I'm a full-time practicing dentist. I really couldn't do it myself. So much to my delight, there was a very keen student by the name of Mitali Suchak, and we started in September of '06, and the clinic finished in April of '07. And this project, this office, was part of her, was her course actually. And so we wanted to. The reason I wanted to have this published was because I knew I was going to do this myself. But what is the environmental benefit of one such dental office? Practically none, right? I knew if we published this, then this would be, we've already done the work, so that this is great. On a day like today, I can share this with you with 50 people or more, and more of these can crop up all over the place, so that the environmental benefit could be much more. But it had to be published so that you could, a template, if you will, could be created. We were fortunate to have the results of the study published in the Journal of the Canadian Dental Association in September of last year. And I'll come back to that. So a little bit about our research. So the goal was to outline the environmental cost of conducting the practice of dentistry, the routine day in, day out, and to show that not only is it justifiable, that is, we're not just going through all this effort to save 1.5 trees, it's justifiable. The environmental costs are significant. We'll get into that. And also, but it's practical too. That is, one doesn't have to, recreate the wheel, and you have to learn how to do dentistry all over again to do it eco-sustainable. That was the aim. And for methodology, there are only 2 of us. We surveyed 5 offices across 3 counties, and we created a case study. And from that case study, we examined and we compared the typical environmental outlay of a conventional office compared to this new proposed green model. And that green model is our clinic, and it was very important that actually we created a viable, functioning clinic. Otherwise, I would be speaking to you right now about what? A theory, right? A hypothesis. And you'd say, yeah, that's nice. But we've been doing it now for about 10 months, so it is real, and it can exist. Okay. This would be a good time to make my disclaimer. This is actually part of my presentation, but I do have to make a disclaimer here also, is that I do not have any financial interest in any of the products I'm about to speak of, or any companies offering grant monies for this continuing dental and medical education program. Okay. So as previously discussed, there are 3 key areas to eco-friendly dentistry. The first one was reducing the resource consumption, what resources we're using. So one example of this is, and I'll come back to this. One example of this is a dry dental vacuum. Okay? And I'm just keeping ahead of myself a little bit. Let me come to this. All right. I'd like to start with explaining an original concept, which I call eco-sterilization. So, as we know, there are essentially 2 ways to manage our instruments. There's using the loose instruments, which we bag in the, in these autoclave bags here, or we can use stainless steel cassettes to hold the instruments. As we can see, using autoclave bags on the left is quite wasteful, because each time we sterilize instruments for each patient, we are throwing away 1 piece of paper, 1 piece of plastic. Unless these can be recycled, that's a great waste. Even if we can recycle them, it's always better to not use something rather than to have to recycle it. So as we can see, the eco-sterilization model begins with stainless steel cassette trays for instrument management. Now, you already have cassettes. You don't have to, or you already have instruments. You don't need to buy new instruments. You may need to buy a few ones. Maybe it's time to buy a few new ones. So an office would just need to purchase these actual cassettes, right? To begin eco-sterilization. So let's go through it. So this approach simultaneously eliminates 3 major resource wastes for every patient. 1, paper and plastic patient bibs, right? Each bib that we put on a patient is 1 or 2 or 3 ply paper and 1 ply plastic. This technique also eliminates the autoclave wrap for loose instruments, as we just saw, the plastic and the paper. And also, even if you were using cassettes before, just show of hands, how many use cassettes? Wow, the majority of you, that's fantastic. Great, good for you. It eliminates using those autoclave wraps. You know, there are disposable autoclave wraps that you're supposed to use, and it eliminates that as well. I'm getting some nods. Come talk to me after. All right. So here we see that sterilized cassettes, like we saw on the previous slide, what we're seeing here is that these cassettes are wrapped in the cotton towels, right? And these cotton towels are sterilized. So let's see how we got there. So we're treating a patient. This is my restorative bin. Here's our lovely patient, my dear wife, co-founder of the clinic. And so we see that the wrap now becomes the patient bib. Okay, the appointment's over. We use an instrument washer on the right here to actually wash the instruments, to wash the cassettes with the instruments. This is in contrast to the, on the left-hand side, when we use the ultrasonic. What are the chemicals that are used in ultrasonics? So now we come to the third aspect of eco-friendly dentistry. Well, there's some fairly harsh ingredients that we use in those ultrasonics. Phenols, glutaraldehydes, maybe some formaldehyde. What are the long-term effects of breathing in those chemicals, which are very volatile, over 10, 20, 30 years? Well, we don't know. It hasn't been studied. You can't study something that long for 30 years. Very, very difficult. So then the clean cassette is now placed into our autoclave. Now what about our waste? As you can see, right in our sterilization center, we have a drawer. It's not hard to make. On the right, we have our wastes, our disposables. And on the left are the bibs, the soiled bibs that we just used. And they stay there, and they collect until our bib is full. Laundry time. In our office, about once a week, we do laundry. We have the facilities where we set up for it, where we wash these bibs and we dry them. Now, are they sterile and ready to go? No, not yet. Now, if you don't have facilities for laundry, there are companies that will come and take your linens, or you can even not provide your own linens and just use a company that will be happy to provide you with fresh linens, and then you don't need to wash your own linens. The cotton towel bib. So in our office, what we do is we take our washed bibs and we put them in a large sterilization packet such as this, and fire a few of these in the autoclave, and now our bibs are sterile. Now, I will say it's very, very important that you do wrap these bibs in a sterilization pouch such as this, because these days, especially with the powerful modern autoclaves, their vacuum phases are very efficient, and they'll actually, literally vacuum the lint off of these cotton towels, and you will ruin your $8,000 autoclave. So be very, very careful. I'm not speaking from experience. I'm just speaking from, I did my research on this so that you wouldn't have to go through this. So you just have to make sure that you use the cover like this, and you will not ruin your. We've been using ours for 10 months, 11 months now, so no problem. Okay, out they come. Here Sherry is showing you our station where she's wrapping a cassette. Now this is a cleaned autoclave cassette on an autoclaved sheet. We're wrapping it up, and then that goes right back upstairs, and we're right back to where we started. Okay? Does that go through the cycle okay? If you have any questions about this, please come and see me. Now, what are the numbers here? Let's look at a little bit. For conservative sized practice, seeing only 16 patients a day, that's all we did our data on, was a conservative sized practice, seeing 16 patients a day. Eco-sterilization amounts to a saving of 3,200 pieces of plastic per year. That's almost 100,000 in a 30-year career. 2 or 3 plied paper bibs would consume accordingly 2 to 3 times that. So 300,000 pieces of paper in a 30-year career for one conservative-sized office. Multiply that by the 50 of us in this room, and I'm sure your practices are not more. You're seeing more than 16 patients a day. But it's not just the disposable bibs' contribution to the landfill that is a concern. In this consumption-driven society of ours, of instant gratification, we must take care not to forget the significant resources that we don't see, the hidden resources that go into making each bib, each piece of paper, right? It's not just a landfill burden. It's the electricity, the water, the manpower, the trees that go into making just one of these bibs that we're using for one appointment and we're throwing away. Countering these consumption trends actually presents an excellent opportunity for us as dentists in our communities to show leadership in the environmental front. This is really a chance we have to, as a profession, to step forward.
Could you repeat how much paper waste that was again?
Sure. For conservative sized practice in 1 year, it's going to be about 10,000 pieces of paper if you're using 3-ply for conservative sized practice. In a career, it'll be about, close to 300,000 or $1 million. I'll take questions at the end if you don't mind. I just want to make sure I get through all this. Thank you. So this graphic shows one reusable operating room cotton towel here, which is what we used, which easily outlasts stacks of the disposable paper bib counterparts. For a 200-day work year, 5,100 pieces of paper are consumed and discarded into the landfills each year. So due to the that's based on 2-ply. So now, due to biohazard contamination, we can't recycle these pieces of paper, and it's not readily easy to separate them. So, as we can see, the environmental benefits are significant. That's clear. What's not clear so far is the cost benefit. What is the cost benefit of using this reusable system versus the disposable one? We'll come back to that. So this picture illustrates reusable glass syringes for endodontics, oral surgery, or periodontics versus countless disposable plastic syringes, which are one-time use only. So the glass syringe on our right is, of course, fully autoclavable and will easily outlast boxes of the disposable plastic one counterparts. Now note, each disposable plastic syringe above is going to the landfill accompanied by, what else? Its own packaging. Right? Each of them, you see that? It's not just the actual needle, but each of them is going to the landfill with its own package. So this slide illustrates more of the same. Here we see a small number of plastic high-volume suction tips versus one stainless steel high-volume suction tip, which will certainly outlast boxes of its disposable counterpart. Now this picture compares surgical suction tips, disposable plastic ones versus stainless steel. Now please note, the manufacturer of all these stainless steel products also provides the appropriate wired brushes for the thorough cleansing of the lumen. There are many sizes for brushes, small, big, so you can thoroughly clean out the lumen before sterilizing these as well. This graphic compares the low-volume suction tips, the stainless steel versus disposable plastic ones. Now, I've tried many brands of these low-volume suction tips, and I can't tell you, I can't find one that's as comfortable as this one. It just does such a beautiful, does the trick beautifully for, especially during a hygiene appointment. So let's look at some more hygiene items here. On the left, we see a typical disposable prophy cup. Again, one is used for every patient, so therefore literally hundreds and thousands of these cups are going into the landfill each year. What's the alternative? Well, on the right, we see my dedicated hygienist, Mary, or at least her hand, showing us some hygiene products. The tubes of prophy paste like this are preventing perhaps hundreds of these pre-dispensed disposable cups with prophy paste in it. And we also recommend using the stainless steel prophy cup, again saving thousands of these ones from going into the landfill. Okay, let's look at adhesive dentistry. So what's the alternative to using hundreds and thousands of these disposable wells for adhesive dentistry? Well, using one rigid well, such as this one, will give you years of service. So this is really such an easy alternative. Now, I hope to challenge you on this topic, friends, that when we are making clinical choices, what adhesives to use, what cements to use, I hope that we'll look beyond what are just the clinical strengths of this product, the megapascals and the fracture toughness and the dentin bonding and all these very important clinical things. I hope we'll look beyond this now and look at packaging, right? What is this favorite cement of mine? What kind of packaging is it coming with, and how wasteful is that? Do you have a less wasteful option? There are so many products in dentistry now that almost always we do. I'm sorry about the confusing sort of slide, but in our survey, all the conventional dental offices use traditional film X-rays. Now, this technology has two significant environmental considerations: silver and lead pollution. Silver is a heavy metal that can enter our water system if improper disposable dental X-ray fixer occurs. Discarding these used solutions down the drain must and can be avoided. This source of water pollution is a cause of concern that can easily be addressed. There are services for dental offices to recycle used radiographic fixer. Contact the supplier of the fixer about a take-back and recycling program if you don't already do so. Another common source of silver which can entertain our landfills and water system is undeveloped film. Now, I know none of you have ever taken a film that wasn't diagnostic or didn't turn out, so I know you don't throw any away, but I'm just kidding. Of course we do that, and so these undeveloped films go into the garbage, and that's a good source of silver right into the landfills if we don't recycle them. Lead pollution is another possible outcome of traditional X-rays. Lead is known to have adverse health effects on both children and adults, even at low doses, just like mercury. And like mercury and silver, lead is toxic and persists in the environment. Lead foil, which envelops the actual film, must not be disposed to the general waste, because this leaches into our landfills, and if our landfill is not absolutely perfect, then these leachates will leach out into our water systems. Okay. So the eco-friendly model would employ digital radiography as an effective environmental alternative to traditional film X-rays. Digital X-rays do not employ silver or lead, so that problem is solved right there. In addition, there is a significant reduction in radiation exposure, as we know, to the patient. So the previous slides were about changing patterns of consumption. Now let's look at bringing our resource consumption in line with nature's economy. That is, using research, are we okay? It's just rebooting.
The batteries that were plugged in.
Yeah, probably just shut down. So I'll just move away here. I can't move away because it's being filmed. Okay. So the previous slides were about changing patterns of consumption. So the next three slides are about actually bringing our resource consumption in line with nature's economy. What is nature's economy? It means simply using resources at a rate less than the rate at which nature can replenish them. It's a very, simple concept, but one that we just doesn't enter into our consciousness. So we would use recommend actually a dry dental vacuum, right, versus the traditional, which is a sort of can be water recycling or water using. The older ones are water using. They don't recycle water at all. Water is simply used to keep our vacuums cool. And those are tremendously wasteful of water. So now the alternative is to use a totally dry, no water vacuum system. So just to give you some numbers, in our practice, that saves about 120,000 gallons of water, fresh potable water every year, just by using a dry dental vacuum. 120,000 gallons. That's equivalent to about 1,500,000 milliliter bottles. This could provide for all the conventions held in this office for 1 year. That's one dental office, just by switching to a dry dental vacuum. So wet and water recycling dental vacuum pumps used by conventional dental offices can go through hundreds of gallons of water a day, and that's needlessly wasted. So given the severe waste of water, this is one of the very strongest recommendations I could make to you, is when you're doing an eco-fit or a new practice, go to a dry dental vacuum. Okay, what about paperless? Ah, beautiful, thank you. Thank you so much. I really want to again thank and reiterate my gratitude to the AV team. I don't know if they eat lunch or if they eat or sleep during these conferences, but they're going all the time. Okay, so what about so again, our model was a 2,000 chart dental office, again a conservative sized dental office. So for a 2,000 chart dental office, at any one time, we don't have 12,600 papers sitting around in all the 2,000 charts. So that's a saving, obviously, of paper. And going forward, we chart on the computer and so on and so forth. So 12,600 pieces of paper. Well, what does that really mean? It's hard to kind of get a figure on that. Well, that weighs approximately 151 pounds. And according to Save-A-Tree, the environmental savings of 151 pounds of paper is 1 tree, 770 gallons of water saved, 82 pounds of landfill reduction, 158 pounds of net greenhouse emissions reduced, okay, and it goes on and on. So there are all these hidden consumables that we don't see. We just think, okay, 1 piece of paper, 1,000 pieces of paper. But there are all these hidden consumables that go towards that 1 piece of paper. So these are the environmental benefits of a digital, or at least a chartless or digital charting office. Now we also use 100% recycled bathroom tissue and paper towels. Now I know what you're all thinking. Isn't there any area that's safe from eco-friendly dentistry? And I was a bit of a skeptic, I have to share with you about this. I thought, we're doing all these other things. We really don't need to have, 100% recycled toilet tissue and paper towel. But this is where the science, shatters your thoughts and your dogmas. But by using, according to this company, 7th Generation, if every household in the U.S. replaced just 1 4-pack of their virgin fiber bathroom tissue, a 4-pack, not a big pack, with 100% recycled ones, we could save, again, close to 1 million trees. Think about that. 1 million trees. 2.5 million cubic feet of land space. That's just an enormous amount of space. That's equal of 3,700 full garbage trucks of landfill space that would be saved. And it goes on and on. Same thing for the paper towels. Okay, green culture lighting indicates that compact fluorescents use about 65% less energy than the standard incandescent light bulbs and last 10 to 20 times longer. Greenpeace International states that compact fluorescents use 4 times less energy and last 8 times longer than incandescent light bulbs. That's a great deal. So thus the eco-friendly model would employ, of course, these compact fluorescent light bulbs. Now we have to be careful not to use them in areas that may be considered high traffic or high accident, because they could, if they break, of course they're going to spill mercury. So we should use them, of course, in areas that are not so in high traffic areas, and of course when they expire they have to be recycled properly because they do contain mercury. Okay, what about choices of computer monitors? Well, in terms of energy savings, the conventional cathode ray tube uses 76 watts of power per hour. 76 watts. The LCD monitor uses about 20. So it's about 4 times as energy efficient. It's not fractional, it's 4 times. And in terms of lifespan, the LCD monitors last twice as long approximately as the CRT monitors, so that reduces also the need for periodic replacement, and it's also another environmental saving because we don't have to recycle these used computer parts as well, which is becoming, more and more of an issue. Okay. The next 3 slides now will talk about the forgotten element of eco-friendly dentistry, which is the breathable air, what we breathe, our environment. In our survey, various surface disinfectants were utilized. Among these agents used in conventional dental offices, the following are just some of the active ingredients: butyl salicyl and hymine 1622. Well, the occupational exposure limits to hymine 1622 have not been established. Those are used in cavi wipes. Anybody who uses cavi wipes. In June 2000, the World Health Organization sounded the alarm regarding the rise of drug resistance that threatens to set back the medical advances of the modern age. Their report illustrates that almost all major infectious diseases are gradually but successfully developing resistance to current antimicrobial agents that we use. Also in June 2000, the Council of Scientific Affairs of the American Medical Association issued a warning that the rampant use of biocides for the purpose of creating a germ-free environment may lead to a suppression of immunity in humans. That's not what we want. And that the rampant use of these biocides, needs to be curtailed and reconsidered. So, what is the alternative? The eco-friendly dental model advocates the use of an alternative disinfectant. This product is from Melaleuca, and this is one which uses the natural antimicrobial agents effects of tea tree oil and thyme. And I have references, as part of the project, we've researched, peer-reviewed papers showing the effectiveness of thyme and melaleuca and tea tree oil against the common pathogens that we may encounter. This product is the only one that's approved by the EPA for use in hospitals and dental offices. Where can you get it? Where can you get it? Melaleuca. Let's examine the types of paint used in dental office. VOCs, or volatile organic compounds, are a major category of pollutants which exert a significant adverse effect on our breathable air. We know they are toxic and they're carcinogenic, and the human health effects of VOCs have been well documented. So, in our survey, all 5 dental offices were using the conventional VOC latex paint. So, if your contractor paints, it's going to be a VOC kind of paint. You have to ask for an alternative. Now recently, low VOC or no VOC paints have become commercially available, and this is one of them from Benjamin Moore. It's a ultra low volatile organic paint called EcoSpec line, and this is what we use. Incidentally, this is probably the only material that we know of in our office that contains latex. We are, other than that, a latex-free office. I won't go into the health benefits of that. Okay, sorry for the picture, but this is radiographic developer and fixer solutions. Now, again, some of the chemicals that are found here are hydroquinone, acetic acid, glutaraldehyde, ammonium bisulfite, sodium bisulfite, and ammonium thiosulfite, among others. These compounds, these chemicals, are volatile. The fraction, the volatile rate is 60 to 90%. That's their volatile percentage. So 60 to 90% of them are readily, volatile. That's why we can smell them when we approach them. Now, in the case of glutaraldehyde, we read that although it is known that glutaraldehyde is a respiratory tract irritant and may aggravate pre-existing asthmatic disorders, the supporting data for respiratory sensitization are less conclusive. For hydroquinone, we are told that there is evidence for the clastogenicity, the chromosome breakdown, using hydroquinone in vivo and in vitro. The relevance of chromosomal effects in test animals in predicting human risk is unclear. I found that so interesting. And this is replete when you look at the MSDS. It's very, very unclear in many of these compounds what are the long-term health effects on humans. So I asked myself, after 30 years of smelling this, how am I going to feel? What are the health effects to me? Of course, what are the health effects to my, to my assistants and to my hygienists? Well, we don't know the answer to that, because you can't study a human being that long to any kind of compound over 30 years. So we just carry on, and we don't know. Carry on using it. What's also interesting is that one of these is a very, very acidic, and one of these is very, very basic. And in the instructions it says that these should not mix. But as we know, these two compounds are put exactly right next to one another. And they're very volatile. And when we're washing them and cleaning them, can we say that there's immaculate washing and refilling, and there is no mixture and there is no touching? Of course not. There is. And when these compounds mix, there's a release of a very, hydrogen sulfide, which is not a gas that, again, we want to be inhaling over any period of time. Worst of all, as we know, X-ray rooms are, by design, meant to be small, dark, no light. You go in there, lock the door, and so there's anything but adequate ventilation in these areas. Just a thought across about our, okay. So in terms of, now these previous examples were very visual, and it's very easy to imagine the environmental wastes and the contribution to our air from these things. But there is an objective assessment of any product's eco-friendliness. If you wanted to know how eco-friendly is a certain product, well, that's called a life cycle analysis, and that's really an environmental currency. Electricity, water, trees, and labor are used to make paper bibs, though these are hidden consumables in the ever-consuming society in which we live. So LCA, life cycle analysis, is the best way to actually measure the environmental impact of an item. From raw materials all the way to the recycling and disposing of that topic, from effects on global warming to indoor air quality, life cycle analysis chart the environmental impact of a product throughout all its stages of its life. Okay. Now what I'd like to see, hopefully in the future, is that all dental products that we buy, in addition to their acidity and their bond strength and their setting time, I would love to see their LCA score. So that when we shop, when we purchase these products, just like we should make any decisions for our purchases, that we can know the environmental impact. Well, what about convenience in general? I was actually interviewed by the American Dental Association in October of last year by a panel of about 25 people. They were calling me right here. They were actually right here in Chicago, phoning me, and I spoke to them on the phone. They were very, very interested in this. I'll touch on this towards the end. And they asked me, well, what about convenience? Certainly eco-friendly dentistry must not be convenient. And I shared with them, my reply to that was, well, when was the last time that doing the convenient thing was the right thing? I think this is an important question to answer. Now, I have good news for you. It is convenient. I'll show you. It doesn't take a whole lot of time. Okay, let's go through that. Also, people ask me, some of the dentists also ask me, well, what about speed? surely it takes much longer to do eco-friendly dentistry than it does traditional dentistry. And here's how we explain it here at the office, or here's how I would answer it to a patient. I would say to them, say your patient's waiting an extra minute. We're a barrier-free office. I should do this. We have no barriers at all. We wipe down our surfaces. Now, that takes a little bit of time. Very little. But it takes... and if a patient comes and they're in a rush, or they're feeling, maybe we're feeling that they're rushed, or they're feeling inconvenienced by the 1 minute that it's taken to wipe down our surfaces, then we just explain to them, Mrs. Jones, we don't use any barriers in this office. These are disposable pieces of plastic that we'd have to use 5 or 10 of them in our op for each patient, and we have to throw these away. So we've taken a decision in the office not to use these, and we're just going to wipe down the barriers. So that takes a minute longer, but we're doing it for the right reasons. It's for the earth. Watch that patient's face light up with joy. They're so happy that they're part of this. They will not mind that minute, and it's really very, very negligible. It takes time to take all those barriers down also. So while you're doing that, you just spend a little bit more time wiping. Well, what about speed in general? I've looked at this issue very carefully, and this is a beautiful car and it goes very fast. And no matter what way I look at it, I just can't environmentally justify this car for my own personal use. Back home, this is what I drive. Gets me around. Okay, so let's look at some eco-friendly recommendations. If I can share these with you, friends. So here's a list of recommendations for making your future dental office or your existing one in eco-fitting it. Implement an eco-friendly sterilization program which simultaneously eliminates the need for the disposable autoclave wraps, for the disposable patient bibs, and for the disposable bags for the actual instruments. Okay. Use an energy-efficient washer and dryer if you have the facility for it, or if not, contract this service out. Use a dry dental vacuum versus a wet one. Again, the water savings are enormous. Consider using digital radiography versus film-based x-rays. If you do use film-based x-rays, then make sure you recycle the fixer and the developer and the lead foil. Seriously consider using less harsh surface disinfectants. I practice in Ontario, Canada, and our dental college has issued a statement actually in 2002 that they actually said, and they're one of the very, very conservative board, they actually said that you may consider just using soap and water may be adequate based on the findings of the World Health Organization. So I think we really have to rethink this a little bit. So consider using a less harsh surface disinfectant. Consider using reusable biodegradable sundries, as we saw, such as the OR stands for operating room cotton towels. Okay, you can get this from Medimart. Stainless steel low volume surgical suction tips, glass irrigation syringe, biodegradable disposable cups for rinsing instead of the Dixie cups, or ones that are biodegradable, made of corn or any other sort of biodegradable material, chlorine-free recycled paper, and stainless steel Profi cups and tubes for hygiene. You may decide to go barrier-free. We have. It's been a very wonderful, liberating experience. If you're interested in your barrier consumption, here's a little tip. You may want to just, as a little research project in your office, go back Monday and tell your staff, tell your team to take all the barriers that they dispose in a day, and just not to put them in the garbage. Create a separate bag for that, and then just go at the end of the day and see how much waste you created just with the barriers that are used in the office. You may want to collect them for a week and just have a look and see how much we're actually using. It's not no one's doing it intentionally. It's out of sight, out of mind. When it goes in the garbage, it's out of our sight, it's out of our mind. It's only when we stop and actually do some of these things and we realize, geez, maybe we should be looking at perhaps a different way to do it. Use fluorescent versus halogen lighting, using the LCD monitor versus the CRT computer monitors. Flooring is a huge topic which I don't have time to get into, but the environmental alternative or the most eco-friendly option for flooring is linoleum. It's a natural flooring substance. It's got linseed oil, flaxseed, various kinds of natural compounds in it. It doesn't off-gas like vinyl. VOCs doesn't off-gas VOCs like vinyl. And also it's biodegradable. So after 10, 15 years, when you finish it, you can throw it in a yard somewhere or whatever you want, and it will degrade. It'll actually biodegrade. It doesn't have to be incinerated and release even more gases like vinyl does. Consider using an ultra-low or no VOC paint. If you own the property where you practice, don't use lawn pesticides. There are organic alternatives which don't have this pesticides. Here's some obvious eco practices. I'll just rattle through these. You may consider switching to 100% recycled chlorine-free paper. In our office, all the paper used is, of course, recycled. We do use a little bit of paper. The business cards, the envelopes, the stationery, they're all printed on recycled paper. All ink cartridges are recycled. All the batteries that we use, we're wireless office, so all our mouse and everything has batteries, and all the batteries are, rechargeable batteries. All toilet paper, paper towels, facial tissues, garbage bags are all made of recycled materials. We use natural soaps. Office cleaning company, the office cleaning company we use only uses vinegar and water to clean our office. And we use eco-friendly laundry detergent for our thing. Okay. So let's look at some possible future research. So the question is eco-friendly dentistry more profitable than conventional dentistry in the long run? One of these bibs costs $2 Canadian. So that's, same thing, right? $2 US now for, yeah. When I first did this slide, it was a lot more. It was like $3 or something, but I can't use that joke today. Markets have changed. So yeah, this is about $2 Canadian for this one bib. Those 500 of those paper plastic bibs go for about 15 Canadian dollars. So therefore, the cost of one of those paper bibs is 7.5 cents. So, therefore, the cost of one bib, for the cost of one of these paper bibs, we could purchase 27 paper bibs. For one cotton bib, we could purchase 27 paper bibs. So the question is, will one of these cotton bibs outlast 27 of those paper bibs? Well, in our clinic, we've been open 10 months now, and we do the laundry usually once a week. So it's not like my assistants are always doing laundry, just once a week. And the laundry does itself, right? You just push the thing. So that is about 40, we've done laundry about 40 times, roughly. So each bib that we've used has been through 40 cycles, and I can tell you they're in great shape. And I expect to get several years out of them. So clearly, easily, on this front alone, doing this is far more economical. Now, the question is, what about all the other sundries that we talked about, the stainless steel suction tips and on and on and on? Well, that's research that needs to be done, and I'm hoping that, at some point somebody will want to do that research. Now, believe me, if eco-friendly dentistry is in fact more cost-effective, every dentist on this planet is all of a sudden going to become an eco-maniac, right? That's going to happen, so I hope that's produced. I just want to finish with some thoughts, friends. I really feel that, you and myself and everybody as dentists, we cannot afford not to go green. There are various reasons for that. First of all, of course, for the planet. Our planet is going through the global warming and environmental degradation, as we've touched on. There's no debating that. Sometimes that's debated on CNN and in coffee shops, but we have to be scientists. There isn't any debate. There isn't any serious scientific evidence that debates this. Ethics, of course, we should do it on that reason alone. Public and marketing. The public is looking for this. Your community are looking for people to stand behind, environmental heroes. So the public will gravitate towards this. And that's not the reason you should do it, but you should know that this happens. And also, in terms of marketing, we can spend lots of dollars on marketing, putting our ads up in this medium or that medium, but any dollar amount that you put into eco-friendly dentistry will, in fact, pay back in terms of real patients and revenue. So what can you do? At the very least, friends, you may consider implementing 2 of these eco-friendly recommendations that I've outlined here on Monday. Get your team involved. As with anything, this is just good practice management. Get your team involved. Create eco-warriors. I've seen this happen where people really, the team really gather around and build, and then they take off with this project, and they become very excited about it. You may add fun incentives for them at certain milestones, like once you've recycled X number of things or whatever, then you can create some incentives for them. You may join the Eco-Dentistry Association. This is very, very new. One of our members of the Academy here, Dr. Fred Pockris, and his wife have started the Eco-Friendly Dentistry, the Eco-Dentistry Association. Just go to Google, type in Eco-Dentistry Association, and you'll be able to get the website to join up. I'll just touch on a little bit about what's happening dentally. As I shared with you, I've been interviewed by the American Dental Association. Our practice as well with Dr. Pockris was featured on the cover of the Access magazine, which is the journal of the American Dental Hygiene Association. At the cover, we're on the cover of the Journal of Canadian Dental Association. So this is really where I feel I want to share with you, friends, that there is a need for you to do this kind of thing. The world, the public, your communities, they all want to, your patients want to know that their dentist is doing these things, and tell their friends about it, tell their family about it, and they'll get behind it. In addition, I think it will be shown to be more economical in the long run, and you'll feel really great about doing it. So I know this is just an outline, but if you do have any questions about how to make your office an eco-fit office, or if you want to creating a new office, please come and see me after the break, and I'd be happy to share any thoughts I have about that. So thank you for your time.